Welcome to the Elevating Aesthetics podcast. I'm Megan Theus.
And I'm Brittany Perez.
And on today's episode, we are going to talk about the evolution of aesthetic medicine.
Yes.
What are your thoughts on this? I have so many things I want to ask you.
So it is continually evolving, and I think that's why it's so important that we continue to educate ourselves, we continue to go to conferences, we continue to read journals, because I think sometimes people take aesthetics less seriously, and I mean that from the patient perspective and the aesthetic provider perspective, and they don't really consider it still practicing medicine. But you can still have adverse outcomes, and it's so important that we know how to not only give excellent treatment outcomes and make beautiful results, but also if we do have something happen, we need to know how to treat that.
Absolutely. And for myself, I am a newer injector. I've been doing this about a year and a half now. And I feel like because of the training that I got at Method, I feel comfortable if something were to happen that I know what to do to fix it. But there are providers out there that maybe don't. And I want to know what your advice is when people reach out to you that haven't had that training, or, what route do they go? Do they try to find somewhere that offers reversal protocol training? Do you share that with what you do with them? Like, what is your...
Yes, that is a great question. Ideally, the training program that you go to has that included, right? And not all training programs are created equal, but ideally you go where they give you like a written protocol, what supplies you need, and then they also will kind of talk you through the process. And then what we recommend in Method is that you go back into your practice and you do a mock VO run through, because ultimately it is not if, it's when. It just is a numbers game. And I've had a few vascular occlusions in the amount of time that I've been injecting, and that's because I've injected thousands of patients. And it also makes the provider more comfortable, because we all fear that one thing. We all fear vascular occlusion, and it's just a lack of education. Just like we fear injecting in the beginning, it's because we feel like we don't know what we're doing. So if you take that fear out of it and you have the confidence to treat anything that could happen, then you're giving safer delivery of treatments to your patients, because ultimately it is an ethical mishap to not know how to treat things that you're doing. If you're injecting, any type of product into your patient and you don't know how to get rid of it or how to reverse it or how to treat an adverse outcome, in my opinion, ultimately you probably shouldn't be doing that until you get the training.
Absolutely. And I actually had this conversation with someone recently, because there are medical providers and some unlicensed providers, and providers probably not even a good word to use, that offer lip filler and other injectables, and they are not certified and have had no training to do that. And I don't think, from a patient perspective, I've been a patient of yours for many years, but I was also a nurse, so I kind of knew a little bit. But for those that have no medical knowledge at all and they're just a patient, they're relying on these providers to know what they're doing. And I also want to take a step back and say a healthy fear is a good thing.
Absolutely.
It's okay to be confident, but you should always have this healthy fear. And I have that. You have that. We all have that, because ultimately, no matter how many people you've injected, everyone's anatomy is different, and there's always that chance and that risk of something happening. And this is a topic that comes up often, because there are so many pop-up places that are offering, hyaluronic acid filler, and they are not trained to do it. And it is a dangerous procedure. I mean, it's a medical procedure, but you should be trained to do that and to know how to fix a vascular occlusion if it arises. And like you said, it's not if, it's when. I have not had that happen yet, but I have had some scares, and I was confident and comfortable because I knew I had you and I had Katie. But for those that don't have those mentors and they don't know what to do, that's scary.
It is scary, and it should be scary.
Yeah, absolutely. And just because you can doesn't mean you should, and just because you are a physician or this or that doesn't necessarily mean that you should be injecting if you don't know exactly what you're doing or how to reverse an emergency like vascular occlusion, because that is a medical emergency.
Yep. And there's other things that can happen too, like we've talked about eyelid ptosis. You can talk about asymmetry. You have people that are using non-dissolvable products before they really have found that artistic eye, and you can kind of help minimize the asymmetry with saline and other modalities. But I think that taking baby steps in the industry is so important. And it's not that people are trying to harm anyone. I don't think it's that. It's that they get so excited. Like there's so many things to offer that they get excited and you want to do everything now. But the best thing for the provider and for the patient is to take it slow and learn a couple of skills at one time instead of jumping full force and wanting to do everything.
Yes.
Because it took me a long time. I did lips only and Botox for probably a year.
Same.
And then I moved into other things.
Yeah, we talked about this on one of our previous podcasts. I didn't start offering biostimulators until I had been doing this for over a year because I felt overwhelmed. And back to what our topic was, this industry is constantly evolving and changing, and there are so many new things that are coming out, but you should be comfortable with several things before you just jump in and start learning something else. And so for me, I just said, I'm not ready to learn that yet. I just feel overwhelmed. So I do feel like if you haven't had the proper training and something happens, you've been so nice in the industry because so many people reach out to you and, they come to you because you are a mentor. And when people ask me, which happens a lot, how do you get started in the industry? The first thing I tell them is to take a course. And, it's up to them which course they choose because there are so many. But I feel like Method's just been so amazing. And I feel like your previous Method students that are now providers always know that they can come to you and they can count on you to help them. So,
there's so much to say, but I think one of the most difficult things in our industry right now is the lack of regulations. There's no minimum standard for aesthetic training, and I don't think that most people know that. If you have the right credentials, or even if you don't, you just place an order and you start injecting, and your patient population is not aware enough to know, to ask, what training did you have? How long have you been injecting? How much
What are
you
injecting?
What are you injecting? There's a couple of providers locally that are using overseas products, and we don't really know exactly what that is, and they're not held liable because they don't have a license to lose. And then you do have people that maybe have an esthetician license that are using maybe a hyaluron pen, and a hyaluron pen is forcing hyaluronic acid with a lot of air pressure, and that can create a vascular occlusion, and they're not licensed to even use a reversal agent, nor do they probably even know that it can cause a vascular occlusion, which can lead to skin necrosis. And I think a lot of it is just a lack of education. But ultimately, if you have a bad patient outcome, your lack of education isn't going to be forgiven in court.
100%. Or when the patient is, a week later, their tissue of their lip is black and dying and necrotic, and they don't know. I mean, like I said, I've been blessed because I had medical knowledge when I first started getting this, but there are people that have never had any treatments at all. They don't know anything about it, and they're messaging me that, oh, well, I can go and get this filler for this price, and I'm like, I don't even know what that filler is. Just there's a lot in our industry and it's evolving, so more people want to do it. It's popular. This is such a great and amazing field to be in. Mm-hmm. It's so fun, and we get so much fulfillment from it, but there are people that are doing it, in my opinion, for the wrong reasons, but also they don't know what they're doing, and that's very scary. So I just wanted your thoughts and opinions, and how would you tell someone when they were looking for training? What would be your advice to a provider who was looking to find training?
I think that that's a really difficult question because there are so many different training companies, and of course I'm going to be biased to myself, but I think what you would be looking for first whenever you're going to a training is look at that trainer's personal work on their social media and on their website, because that speaks volumes. But also, what is their presence in the industry? And that can come from so many different ways. The way that I personally, if I wasn't in my position, the way I would find someone would be probably through a group with referrals. We have so many Facebook groups that have a lot of different providers in there, and people are speaking from personal experience, so I find a lot of value in that as well. So there's a couple of different check boxes that I would look for, and even having a Zoom call or a conversation with the person. We actually recommend, before anyone takes a Method class, to do a Zoom with us, see if we're a good fit, see if we offer everything that you need, and check the course description and make sure that everything that you're looking for in a course is aligned in there, and make sure that you have hands-on models, because sometimes you'll go to a course and you're just watching, or you only get to poke one time, and you're not going to really take anything away from that. You're going to need another course. And not to be negative, but I don't think people realize how much training really isn't making the providers money. We make money in clinic, and training is something we do out of passion, because ultimately we could make 2 or 3 times that in a clinic day.
Right.
So really we do it to further the industry and make the industry better. And even though it seems expensive, ultimately for us, it's more of a favor.
And online certification is not the same as hands-on and in-person. And that's another thing that people don't understand. You know, just because someone has a certification, it could be from an online, you know, a website that offers it and you just pay for it. And I can speak on method because I've had multiple method courses, and I can't obviously imagine doing what I do without that knowledge and the handbooks. Like being able to go back and refer to that information is critical.
I think if I could change one thing in our industry right now, it would be to have standardized education. And that's so difficult because, you know, there's so many different NP programs and PA programs, and there's not even really standardization in our NP program. So to get standardization in the aesthetic industry is difficult, but I would love to see minimum entry standards, meaning like you have to take this many hours of a course, and these are the requirements like within the course that you have to cover. You have to do this many hands-on hours, you have to do this type of didactic. And I don't think it should only apply to NPs and PAs. I think it should apply to MDs as well. And
Absolutely.
I think that is where the difficulty lies, and that's where there's not standardization in our industry. Because if you go to an MD and you're like, oh, you have to meet these same requirements as an NP or a PA before you can inject, then obviously that would be a very hot topic. But I think that's why there's a lack of regulation, because you can't put it on some aesthetic providers and not the rest.
Yes.
And I don't know what the right answer is, but I think that more than anything, patients need to advocate for themselves and really do a lot of research, because you can have a great result and that is fantastic, but the result isn't the only thing. You have to think about so many other things. Like, is it an ethical provider? Are they going to recommend only what you need, or are they going to potentially overfill you? Do they have a medical director, if they're supposed to have a medical director, that is able to help, you know, negate any adverse events? Do they know how to like tell you what protocols to go through? What type of training has a person had? You know, who do they have as a mentor to help if something does happen, or do they know how to handle it themselves? There's just so many things that go into it, and I think mostly patients focus on price and result.
I agree, and I think I love when I see, even in one of my most recent method classes, there were 2 physicians, and I love whenever, you know, dentists and doctors and things come, because that says to me like they want to learn, they want to know whether, and they may be in the room with RNs and NPs learning to inject, but it's just as important for those with DMD or MD behind their name, in my opinion, to have the same training that we have, because it is dangerous. And although you can get beautiful results, you can also cause an emergency.
You can, and you know, ultimately, again, there is no standard training. So just because you are an RN or you are an MD, it doesn't make one of those better injectors, because we all learn AMP. Like, we're all learning anatomy. It's about the artistry. It's about knowing how and when to stop.
Right.
You know, like, have you had enough? It's knowing how to consult the patient and really identify all their needs and prioritize their needs. It's about having rapport, open communication.
Right.
It's about building care plans. Like, there's so much more to it, that it's not just the degree that matters. It is really the person, how much they love the industry, how much they really want what's best for the patient.
And it's not just something they do like on the side.
Right.
This is just like a weekend side hustle. It's fun for them. I mean, it really has to be more than that, in my opinion, for it to really be great. So
yes. I think that there's so many more great things to come into the industry, and I am super excited, even
Me
starting
too.
with PDGF. And, you know, I love research. I love being able to do trials on patients, and every single year there's new products, new techniques, new skincare. There's just always something coming in the industry. And so if you want to be a great provider, you have to stay in communication with your reps, read the journals, make sure you're in some type of group where you are talking to a lot of other colleagues. If you don't, of course, find some friends in the industry.
Go to conferences.
Yes, network, go to conferences. I think that that's so important.
Awesome. Well,
yes.
Cheers.
Cheers. If you guys have any questions about, you know, training for adverse events or anything you need to know about the industry, I'm always happy to answer questions. Happy to jump on a Zoom call. It is methodaa.com if you need any more information.
All right.